I want to invite Senator Hoylman now to the stage. Senator, are you able to turn your camera and mic on?
Yes. Let me
There
just.
we go.
I'm here. Yes. Nice to
Yes.
see you.
Well, thank you for joining us.
Thank you, Ron.
I know we've been talking about these issues for years now, and we're so excited that the Child Parent Security Act that you introduced and spearheaded along with other legislators in the last few years have made it to the finishing line. And we're just so hopeful that maybe, speaking of momentum, maybe there's momentum in New York right now. Maybe we can use that momentum to say, hold on, we passed IVF just before we passed surrogacy. Maybe now is the right time to go back and just put a little correction to the IVF coverage now that we know that it's not inclusive. Do you think there's a path forward along these lines in New York?
Well, yes, I do. And Ron, first, thank you and your entire apparatus and everyone on this Zoom for being so supportive of legalizing gestational surrogacy in New York. You played an enormous outsized role in getting us across the finish line. It have been so many years where New Yorkers were denied the chance to create families through gestational surrogacy. And, you know, the fact that we were only one of 2 states in the country, along with Michigan, that refused to enforce both compensated and uncompensated surrogacy agreements. And it actually imposed fines and criminal sanctions on people involved in compensated surrogacy agreements was something that needed to be corrected. So I'm glad that New York State has joined the civilized world in allowing surrogacy agreements to be in effect in law. But it also operates on the principle that intended parents have a clear and secure legal recognition of their parentage, and that the law protects the health and the well-being and the personal autonomy of the women acting as surrogacy, and that our law serves as a model for other states to encourage other people to come to New York to enjoy the great medical institutions we have and the expertise of medical professionals, and now the legal protections that we offer. But in terms of IVF, yeah, we need to revisit that and ensure that coverage is included for our families. My husband and I have a 10-year-old and a 3-year-old. I actually kind of have to pause when I say that. Those on this Zoom will realize that when you do have kids, the time flies, as you know, Ron. But we can make some changes to the law that improve it and make it more inclusive for everyone. And thank you for your suggestions so far. I think the time is ripe. The surrogacy law in New York goes into effect on February 15, the day after Valentine's Day here. And I'm very excited to see LGBTQ families, people struggling with fertility, and individuals taking advantage of this great law.
Thank you. And we have a section on tomorrow, on Saturday, at our conference. Our conference for intended parents starts tomorrow morning. And we will be covering the Child Parent Security Act, the reform. We think New York, was late to the game, but also has late adopter benefits here. We do think it's the best bill in the country. And it's time to make it better. One of the provisions in the bill is that the surrogate does need to have health insurance for her pregnancy and after that. And we just hope, since that was not necessarily debated or covered in the original session or the original bill, that we're not going to have to pay out of pocket for those insurance plans. And part of what we talked about today could be an incentive for us to also think about how do we make sure that insurance companies don't start adding exclusions such that we will end up having to pay for this out of pocket. If a woman in New York, wouldn't you agree that if a woman in New York carries a baby, either for her or for a couple that can't carry it on their own, her health insurance should cover the pregnancy?
It would seem to make sense, whether it's a private policy or something that's offered by the, through the state or federal government. And we could have a great bearing on those kind of cases. The whole goal of our legislation, Ron, as you know, was to not just protect the individuals who contract to these types of agreements. And, pregnancy is not a risk-free arrangement, by any means. So we want to protect the surrogates and the donors and the intended families. But by having more states legalize it and give folks the opportunity to pursue it, we hope we bring the cost down. And what you're suggesting would contribute to that ultimate goal. And I just have to also shout out my Assembly colleague, Amy Pollan, who's been wonderful in advancing this legislation. I hope we can work with her as well in making sure that we develop some common sense improvements to the legislation that we have now, the statute on February 15th that goes into effect.
And what a dream come true. It was really not a slow, a fast process. And I really think that we have the opportunity to do it quite fast here, and to make sure, I think I have a sense that political opposition is going to be much weaker, if at all, to saying if you already have IVF coverage and if you already have surrogacy, it stands to mind that it should be inclusive. And I think hopefully we can do this rather quickly. Risa Levine said before that legislation takes 8 years. Sometimes it takes 4 decades, but sometimes it could also be much sooner. So thank you so much for your leadership and your hard work. This was not easily won, and we look forward to having you as an ally in whatever capacity in your political career. So thank you so much. You're welcome to stick around. We're going to have some discussion about another terrific New York institution now, and we later will have a discussion in the tables. So thank you so much, Brad.
Thank you. Good to see you again, and thanks for your advocacy.